Hello everyone and welcome back to Medi Notes from Medicos. The topic that we're going to deal today is DNS from ENT, also known as otorhinolaryngology. So this is a very interesting topic. We have the agenda for this as introduction, etiology, types, clinical features and the treatment. So let's, without any further ado, jump into the topic. So what is DNS? DNS means deviated nasal septum. So the epidemiology, it is seen more in male than in female, and this DNS is one of the major cause of nasal obstruction. Now we'll go for the etiology. The first one is the trauma. Now when we go to the trauma, you can see that the displacement of the septal cartilage from the Vomiran groove. I will be showing the Vomiran groove in the further slides, and maxillary crest. Then it can be because of some sort of crushing blow from the front that might cause buckling, twisting, fractures and duplication of the nasal septum with telescopy of its fragments. It can also be caused by inflection during birth if the birth is a difficult one where the nose is pressed in the passage of the birth canal. Then we have the developmental error. When we go to the developmental error, you can be usually by tectoseptal process, the nasal septum is formed. So what happens is it descends to meet the two halves of the developing palate in the midline. A failure in this or any unequal growth between this palate and the base of the skull might cause buckling of the nasal septum. And in other cases, like for example mouth breathers, it's seen mostly in adenoid hypertrophy. The palate is often highly arched and the septum is usually deviated. In congenital cases, you can see in cleft lip and cleft palate more commonly. It can also be seen in certain sort of dental abnormalities. When we go for the racial factors, you can see that it is more in the Caucasians than the Black Americans. We can go to the hereditary factors now. In usually it's not that significant, but there are some cases in which several members of the same family might have deviated nasal septum. So if I take an example, my nose is a bit deviated and so was my father's nose and his father too. So I have a deviated nose as hereditary factor. Now there are types of DNS which are of 5 types. The first one is the anterior dislocation. If you can see over here, I will be showing you. This over here is a normal nasal septum. When we go for the anterior dislocation, what happens is the septal cartilage, it would be displaced into one of the nasal deviation. So what happens is this is the dislocation of the caudal septum. Next we will be seeing as the C-shaped deformity. If you go over here, you can see a C-shaped deformity. Here this septum is deviated in a curve over at one side and the nasal chamber on the concave side is wider. This is narrower on this is wider on comparison with the this side, if you can see. And this usually would be showing compensatory hypertrophy of the turbinates over here. Then we have the S-shaped deviation. So usually this would be causing a unilateral blockage of the nasal of the nose. When we go for the bilateral obstruction, you can see S-shaped is one of the bilateral nose deviation reason, and it is either vertical or anterior-posterior plainly. So it is S-shaped over here. Then we have the spurs. What is spurs? Spurs is actually a shelf-like projection often found at the junction of the bone and the cartilage. So it would be like somewhat over like this, and this might cause headache. If we have spurs, we might have headache too because it presses at the lateral wall of the nose, and it might lead to further repeated epistaxis. Epistaxis means the bleeding of the nose from the vessels because of its stretching on the convex surface. Next is the thickening of the nasal septum. The thickening of the nasal septum, it can be due to some overriding of dislocated septal fragments or some hematoma. Now we'll be going for the clinical features. So what are the clinical features? In nasal obstruction, we will be seeing it can either be unilateral or bilateral depending on the type of the septal deformity, as I have said. If we have high septal deviation, it can cause nasal obstruction than the lower one because of the respiratory current that pass through the upper part of the nasal septum. Then we have, based on the nasal obstruction, the site can also be determined. So if it is a vestibular one, you will be seeing the caudal septal dislocation that we saw in the previous slide. If it is a nasal valve, then you would be it would be mostly in post rhinoplasty, and it can have sin K also in it. If it is at the attic, so it would be along the part of the nasal septum due to high septal deviation. If it is terminal, you will be having hypertrophic turbinates or concave bullosa. You can see the hypertrophic turbinates in the C-shaped deviation. Then we have the choanal. In choanal atresia or choanal polyp, we can be seeing this. Choanal atresia, it can be missed in infancy and the childhood, but it is more prominent in the adult. Choanal polyp may be missed on the anterior rhinoscopy unless posterior rhinoscopy or nasal endoscopy is done. So we can find this nasal obstruction due to the abnormality of the nasal valve by a test known as the Kotel test. Next, we have the headache. Usually, as I have said in the previous slide, you have spurs formation in the nose. In certain deviation is spur formation, and that might lead to headache as well as epistaxis. So the epistaxis is formed usually due to the crust formation of the drying effect on the mucosa of the deviated nasal septum. Now we have the sinusitis. Sinusitis is caused by the obstruction of the sinus ostia, which causes the poor ventilation of the sinuses. Then we have the external deformity. So if the nasal deviation is um, because of the cartilaginous portion, then it is associated with the cartilaginous deviation, or it can be both bony and cartilaginous dorsum of the nose, or it can be the deformity of the nasal tip or the columna. And we have the anosmia. Anosmia means it is a total or partial loss of the smell. Often these clinical features are also associated with middle ear infection. Now I'll be going for the treatment. Okay, as I said in the first slide about injury to the Vomeron groove, this place over here is the Vomeron groove. So any injury over this region can also cause a DNS, that is in trauma cases. Now we will be going for the treatment. If we have a minor degree, majorly most of them would have some sort of nasal deviation. It is normal. So if there is minor degrees of this nasal deviation along with no symptoms, like uh, no obstruction in smell, or it's not having any nasal obstruction, no breathing difficulties or mouth breathing, then no treatment is required. However, if if minor degrees also cause symptoms like what we have seen in the previous slide, then we have to go either SMR operation or the septoplasty. So usually the SMR operation is done under local anesthesia, and it is done by removal of the deflected parts of the bony and cartilaginous septum, and they reposition the flaps. However, septoplasty is actually a constructive approach. Here, much of the septal framework is retained. However, in SMR operation, we won't retain the septal framework. In septoplasty, what we do is most of the deviated parts we remove, and the remaining septal framework we correct it, and then we do a repositioning by plastic means. And usually we prefer this to be done after 17 years of age, so that we don't affect the growth of the nasal skeleton. However, if a child has severe septal deviation with marked nasal obstruction, then we go for the conservative septal surgery so that we can provide them good airway. So that was the video for today. I hope you like this video. If you like this video, don't forget to like, share and subscribe to our channel. We'll be coming with more videos. Till then, stay tuned. Happy learning. This is Ashnavi Raju signing off for today. Bye.